Hello guys, welcome back to our YouTube channel. Yes, our YouTube channel. Is your favorite girl Precious, and this is Talk with Precious. Okay, in our previous video we made mention of going into details about the healthcare system of the various countries. First, if you haven't seen that video, I will be leaving a link below where you can watch, and please don't forget to like, share and subscribe. In today's video, we'll be starting with Spain. Spain operates the universal healthcare system. Okay, let me rephrase. Spain operates almost universal healthcare system. When I say almost, it means that there are some specialists that the public healthcare does not cover, like dentist, therapy, and some cases of mental health. For you to have access to those specialists, it has to be through private hospital. But that notwithstanding, children under the age of 15 and pregnant women are excluded. People that can have access to this public health care in Spain are a salary earner or a self-employed and also living in Spain. Dependent of the salary earner and self-employed also have access to the public health care. Then also we have the pensioners, we have people with some certain socio-economic situation. Undocumented migrants can also have access to the public health care in Spain, but they will be paying for it. Before moving on, for clarity, the healthcare system in Spain is not totally free, although people consider it as free, but it's not totally free. It's not, because every month you pay your tax as a salary earner or a self-employed, and from that tax that you pay every month, they deduct some minimal percentage into the health sector. So that's why you just walk into a hospital and you get treated free of charge without paying anything that you think is free. No, it's not totally free. You are paying for it. You are paying for it from your tax, although it's minimal. Right. Now, let's continue with the people that can gain access. We made mention of people that are living and working in Spain, dependent of pensioners, students under the age of 26. And when I mean students under the age of 26, I'm not talking about international students from the third countries. No, I mean students that are living or from the European Union countries, from the EFTA. International students coming from a third country, they will need to include a healthcare insurance in their visa application. In Spain, depending on your socio-economic situation, prescribed medications are free. Yeah, they are free. Don't think, oh, I'm living in Spain, I'm working, so automatically I will just gain access to their public health care. No. You need to register for it, and the body in charge of the registration is called INS, which is Instituto Nacional de la Seguridad Social. In English, is the Institute Social Security Institute. So you go there, you apply. You can do it online. You can go there with an appointment. So you go there, you apply, you fill the form, and they will get back to you with an approval letter. So you take the approval letter, your ID, your Libro de Familia, if you have it, then empadronamiento, proof of address. You take them to your primary medical attention center. So you take it there, they will register you and assign a family doctor to you. So anything related to your health, it has to pass through your family doctor. So they will give you a card. They will assign it after some weeks. They will assign a card to you, and in that card you have all your prescribed medications, you have your health informations, you have everything in that card that they will be assigning to you. Any specialist you want to see, everything related to you have to be through your family doctor. For instance, probably you want to see a gynecologist, for instance, you need to pass through your family doctor, and your family doctor will authorize it before you can see the gynecologist or any specialist that is covered by the public health care. Then for that, in some cases, as I made mention of, some prescribed medications are free depending on your social economic situation. Let's move on to our next country. The next country we'll be looking into is Italy. And of course, we'll be having my sister Promise to be sharing that information with us. Let's learn together.
Hi everyone, welcome back to Talk with Precious. Mi chiamo Promise. My name is Promise, and I will cover what you need to know about the Italian healthcare system in this video. I'll be giving you a rundown of the public healthcare system, including what it covers for citizens and people with a resident permit. It's not very hard for you to find doctors. However, it's very advisable for you to do your own research prior to going to Italy. That being said, let's get straight into this video. So before giving you information regarding this video, I would like to let you know that most of the information I'm giving you, I did get them online. Of course, some of them are based on what I've experienced in Italy. However, most information I did get them from a website. I will be leaving the link down below. And also, please do be reminded to do your own research. History facts. Did you know that Italians are considered one of the most healthiest people in the world? This was actually a study done back in 2019, and it comes to the conclusion that they are one of the most healthiest people in the world due to their balanced diets and their ways of life. However, despite them being the most healthiest people in the world, their healthcare system is a little bit lacking. If you remember our previous video, that's if you've seen our previous video. If you haven't seen our previous video, we will be leaving a link down below. Please check it out as we were giving information regarding Italy, UK, and Spain in general. Back to the video. So yes, based on a study done by the World Health Organization, Italy also has one of the best healthcare system in the world. However, this is a rating based on life expectancy. In reality, Italian public hospitals are underfunded and overcrowded. However, despite that, major cities like Milan, Rome, all these metropolitan cities offer high quality services than smaller cities. Italy has a mixed private and public healthcare system, and you can switch between the two at any moment. That's if you are eligible. All legal inhabitants, including Italians, foreigners, are entitled to the public healthcare system in Italy. However, for you to be entitled, you need to register to the Servizio Sanitario Nazionale, that's the SSN. They typically provide these services at no cost or for a little fee. So let's get deep into the SSN. So first thing first, for you to be eligible to the public healthcare system in Italy, you need to obtain the SSN. Obtaining the SSN is actually quite simple. You need to go to the Agenzia Sanitaria Locale, which is a healthcare facility in your own neighborhood, Italy neighborhood. Once you get there, you just need to register with them. Once you're registered, they will be giving you something called a Tessera Sanitaria. It's kind of like a healthcare card. Once you've been given that, you can then select your public primary care physician, also known as medico de base. Then you can also select for pediatrician if necessary. And also, once those are all done, you can then request for medical leave, at home care. So talking about the registration, please be informed that there are two types of registration. There is the voluntary registration, which is typically for people with short stay, such as visitors or students. And there's also the mandatory registration, which is for family members, mostly residents, workers, and so on. So before you visit your local healthcare facility, the ASL, you need to actually know which requirements applies to you, and then you can receive the form to fill. So once you get the form, I think you get the form in your post office When you're also in the post office, you also need to get something called Bollettino Postale. So you get the form, you fill the form, you get the Bollettino Postale, you pay for it, and then you're given a receipt. Once you're given the receipt, you can then book an appointment with your ASL. You go there with your passport, your tax code, your resident permits, and your residency, and the receipt of payments. Once that is all done, your Tessera Sanitaria will be sent directly to your address. And please be informed that your Tessera Sanitaria, which is your health card, is valid as long as your permission to stay in the country is valid. Please be informed that if you do renew your resident permit, you also need to renew. It's important for you to know what the Italian healthcare system covers. The Italian healthcare system covers all medical procedure for legal residents. Dental care is free in emergency cases and for all children up to 16 years of age. Other procedures such as orthodontics, laser eye surgery, I think cosmetic surgery are not covered by public health care. Okay. Prescription medication is typically like subsidized but may cost you a fraction of the price depending on the type of medication and the level of income. The healthcare cost in Italy, as mentioned before, you do not pay to visit your family doctor or pediatrician. And treatments that required surgery or hospitalization in public hospital are also free of charge. However, in some cases, you might be asked to co-pay for some procedures. And this co-payments used to be 36 euros. Please and please and please do not forget to subscribe to our channel. Click the notification bell down below so you can always get a notification for every time we post. Please do not forget to like this video, give this video a thumbs up. Please also share this video and leave a comment down below if you wish to know more about the Italian healthcare system. Anything we didn't cover, you can always let us know what you would like to know. And if there's any subject in particular you would want us to talk about, please leave a comment down below and we'll try to get to it.
Welcome back, and I hope you learned one or two from Promise. Now, the next country we'll be looking into is UK, United Kingdom. Today we have special guests, special guests that will be giving us that all informations we need to know concerning the healthcare system in the UK. This special guest is no other. In fact, just watch.
Hi guys, my name is Ivy and I'm going to be talking about the health system in the United Kingdom. First of all, I would love to make mention of the organization in charge of this health system that is called NHS. NHS stands for National Health Services, and this was born on the 5th of July 1948. Not quite long, right? Well, prior to this time, only the wealthy people were able to access the health system, or through the charity and teaching hospitals. Here in the United Kingdom, we have 4 health services. That's NHS England, NHS Scotland, NHS Wales, and HSC Northern Ireland. HSC stands for Health and Social Care. Here in the United Kingdom, the department in charge of these health services is called Department of Health and Social Care. The answer to if the NHS or the health services in the United Kingdom is free or not, that could be a yes or a no, depending on the situation of each individual. For example, someone that is living in the United Kingdom lawfully and on a settled basis would definitely have the NHS free of charge. But don't you forget, you are still paying through tax. Yes. But for someone that is coming to the United Kingdom to study as an international student, for example, coming from Africa, for less than 6 months, will have to pay for the NHS and will be seen as a private patient. But if you are coming as an international student for more than 6 months, the NHS will be free of charge for you and your dependents. Process required, where to go and how to apply for it. Very, very important information, guys. Very important, because obviously after knowing what the documents you will need for you to gain access to the health services here in the United Kingdom, you should go and register, right? Well, as for someone like me that I'm living here in the United Kingdom lawfully, all I need to do is to go to my general practitioner at my local medical center and submit my passport and my proof of address. That's it. And after a couple of days, I receive a letter with my NHS number on it. But for an international student that is going to be residing here in the United Kingdom for 6 months or more, please, your health is very important. Don't wait until you fall ill. Please, it's very, very important. Just go to your local medical center and submit all the documents required. Okay, let's deep inside some services in the NHS system. But a very important information, depending on your situation or on the situation of each individual, you may or may not have to pay for some services. Okay, so now let's start with people living lawfully here in the United Kingdom. You don't have to pay for NHS dental service if you are under 18 or 19 years old and in a full-time education. Or if you're a pregnant woman or you just had a baby in the last 12 months. Or you are receiving low-income benefit, or if you are under 20 years old and a dependent of someone receiving low-income benefits. In terms of gynecology, here in the UK, the NHS provides a range of services, including doctor's appointment, obstetrics, cervical screening, and so on and so on. If you are an international student, your dental care is not free. Yeah. But when it's an emergency surgery or a surgery, important surgery, it's going to be free. How to gain access to the NHS or health services here in the United Kingdom requirement. Well, based on my experience as someone that is living here in the United Kingdom, I will have to say that all I needed to provide was my passport and my proof of address. But for an international student, you will have to provide a letter from the university that you are enrolled in, your passport, and any immigration document or visa. And that's not all. You see, on the process of doing your international student visa, either you are going to study in the UK for 6 months, less than 6 months, or more than 6 months, there's a fee that you will have to pay, and that's very important fee, a fee you can't escape. As for now, the fee for international students coming to the United Kingdom to study for less than 6 months is £235. For international students coming to the United Kingdom to study for more than 6 months, you will have to pay a fee of £470.
Welcome back. I hope you learned one or two from my dear sister Ivy. As we have come to the end of today's video, I hope you enjoyed it and above all you learned from it. If you have any question or any topic you want us to talk about, please don't forget or don't hesitate in leaving them in the comment section. we will be right there to answer to them and to talk about that topic that you'll be wanting us to talk about. For now, please don't forget to like, subscribe, and share. See you on my next one. Is your favorite girls, Precious Promise and Ivy.